morning everyone. Topic for today's presentation is water-soluble vitamins. Water-soluble vitamins are vitamin C, riboflavin, thiamine, niacin, choline, folic acid, vitamin B12 and pantothenic acid. Vitamin C. Vitamin C is necessary for a number of metabolic processes including hydrogen ion transfers and maintenance of intracellular oxidation reduction potentials. It also acts as an antioxidant, facilitates iron uptake in the intestinal tract, and is involved in the formation of folinic acid. The requirements are: the recommended dietary intake for vitamin C ranges from 35 mg in infants to 60 mg in adults. Pregnant and lactating women should increase their daily intake by 20 mg and 40 mg respectively. Clinical features. The oral effects of vitamin C deficiency in humans occur chiefly in the gingival and periodontal tissues. The interdental and marginal gingiva is bright red with a swollen, smooth and shiny surface. In infants, the enlarged tissues may cover the clinical crowns of the teeth. In almost all cases, gingival ulcers show typical organisms and the patients have the typical fold breadth of Merson's with fusospirochetal stomatitis. In severe cases of scurvy, swelling of periodontal membranes occur. The symptoms of vitamin C deficiency are gingivitis, easy bruising, nosebleeds, digestive disorders, immune impairment, joint pain, dry skin, dry splinting hair, slow wound healing. Coming to riboflavin. Riboflavin is a vitamin B2 deficiency. It is a fully dialysable, intensely yellow water-soluble pigment which is decomposed by light. It fluoresces green under ultraviolet illumination, is readily absorbed from the intestinal tract, and is phosphorylated in the walls of the intestine as well as in other tissues of the body. The riboflavin deficiencies are almost always due to dietary deficiency. Its requirement is increased during pregnancy, lactation, and heavy exercise. The recommended daily allowance for the riboflavin ranges from 0.4 mg for infants to 1.7 mg for young adults. Pregnant and lactating women should increase their daily dietary intake by 0.3 mg and 0.5 mg respectively. Clinical features. Riboflavin deficiency is particularly common among children who do not drink milk. In the milder cases, there is a glossitis which begins with soreness of the tip and on the lateral margins of the tongue. The filiform papilla becomes atrophic while the fungiform papilla remains normal, or it also becomes engorged and mushroom shaped. The tongue becomes reddened and coarsely granular appearance occurs. The lesions extend backward over the dorsum of the tongue. In severe cases, the tongue may become glazed and smooth, owing to a complete atrophy of all papillae. In many cases, the tongue has a magenta color, which can be distinguished from cyanosis. Paleness of lip at the angles of the mouth, but not involving the moist areas of the buccal mucosa, is an early sign of this disease. The pallor, which continues for days, is followed by chelosis, which is evidenced by maceration and fissuring at the angles of the mouth. The fissures may be single or multiple. Later, these lesions develop a dry yellow crust which can be removed without causing bleeding. Thiamine. Thiamine is a vitamin B1 deficiency, and it is a colorless basic organic compound composed of a sulfated pyridamine ring. It is phosphorylated mainly by the liver and to a lesser extent by the kidney. In tissues, thiamine is found as thiamine pyrophosphate, rarely as free thiamine. The main source of thiamine are yeast, pork, legumes, whole grains, and nuts. The recommended daily dietary allowance for thiamine ranges from 0.3 mg for infants to 1.5 mg for young adults. Pregnant and lactating women should increase the dietary daily intake by 0.4 mg and 0.5 mg respectively. Clinical features. In man, thiamine deficiency leads to beriberi, which is generally insidious in onset, chronic in course, and sudden death may occur. Beriberi may be of two types, wet and dry. In either forms, patients may complain of pain and paresthesia. Wet beriberi manifests with cardiovascular symptoms due to impaired myocardial energy metabolism, cardiomegaly, high output cardiac failure, peripheral edema, and peripheral neuritis. In dry beriberi, same symptoms occur but for the edema. Alcoholic patients with chronic thiamine deficiency are having CNS manifestations known as wernic encephalopathy, which consists of horizontal nystagmus, ophthalmoplegia, cerebral ataxia, and mental impairment. Along with the above-mentioned symptoms, if there is loss of memory and confibulatory psychosis, it is known as Wernicke-Korsakoff syndrome. Niacin. In the living organisms, ingested niacin transformed into nicotinic acid amide, which is utilized to form coenzyme 1 and coenzyme 2. A deficiency of this vitamin leads to the classic symptoms of pellagra in human beings and to black tongue in dogs. Pellagra, as a widespread problem in the southeastern United States, has largely disappeared. The recommended daily allowance for niacin ranges from 6 mg of niacin equivalents in infants to 10 mg NE in young adults. Pregnant and lactating women should increase their daily intake by 2 mg and 5 mg NE respectively. Clinical features. The mucous membrane lesions affecting the tongue, oral cavity, and vagina are usually the earliest lesions diagnostics of the disease. Other lesions common in pellagra are the typical dermal lesions of bilaterally symmetric, sharply outlined, roughened, keratotic areas. Mental symptoms and weight loss also occur. The patient then usually complains of a burning sensation in the tongue, which becomes swollen and pressed against the teeth, causing indentations. The tip and lateral margins of the tongue become red. In acute stages, the entire oral mucosa becomes fiery red and painful. Superimposed necrotizing ulcerative gingiva stomatitis or Vincent's infection involving the gingiva, tongue, and oral mucosa is a common sequel. Epithelial changes followed by the characteristic skin rash, particularly in the areas exposed to sunlight, especially in the neck region, are called Castle's necklace. Vaginitis and esophagitis may also occur. Folic acid. Folic acid is essential for the growth of many animal species and is also essential in man. The primary function of folic acid is the transfer of one carbon moieties in the number of metabolic reactions. Folic acid is also necessary for purine synthesis. The synthesis of DNA is impossible in the absence of folic acid. The minimal dietary daily allowance for folic acid ranges from 30 mcg in infants to 400 mcg in adults. Pregnant women should double their daily intake, while nursing mothers should increase their daily intake by 25%. Clinical features. Folic acid deficiency in man is characterized by glossitis, diarrhea, and macrocytic anemia. The glossitis appears initially as a swelling and redness of the tip and lateral margins of the dorsum. The filiform papilla are the first to disappear. The fungiform papilla remain as prominent spots. In advanced cases, the fungiform papilla are lost and the tongue becomes slick, smooth, and either pallid or fiery red in color. Colon. Colon is an important constituent of lecithin, certain sphingomyelins, and acetylcholine. No oral lesions have been ascribed to colon deficiency in man. Vitamin B12. This vitamin includes a group of closely related compounds, the most common form being cyanocobalamin. It is the anti-pernicious anemia factor and it has also been used in trigeminal neuralgia cases. The minimal daily allowance for vitamin B12 range from 0.5 mcg in infants to 3 mcg in adults. Pregnant and lactating women should increase their intake by 30%. Pantothenic acid. The role of pantothenic acid in metabolic processes is not at all clear. It is a constituent of coenzyme A and is widely distributed in foods. The human requirement for this vitamin is unknown. 5 to 10 mg per day is considered adequate for children and adults. References: Schaeffer's Textbook of Oral Pathology 7th edition, Oral and Maxillofacial Pathology, Brad W. Neville.